What is the standard American diet? The average American gets about 25% of her calories from animal foods. About 63% comes from processed foods. So that's added oil, it's sugar, and that's refined grains. And then she gets about 12% of her calories from plant foods, but about half of that is pretty much French fries. So only about 6% of that really counts. So the average American is getting about 6% of her calories from fruits and veggies. And this has devastating consequences. Right now, in the United States, 7 out of 10 deaths are caused by chronic disease. And chronic disease comes from the way that we eat and the way that we live our lives. So the deep question that I'd like for us all to ask ourselves is, how do we make the right choices the easy choices? And I want to take you through a little bit of an exercise. So I'd like for everybody to just close your eyes for a minute and imagine a mom. She's standing at her kitchen sink at 6:30 on a Wednesday. She just got home from work. She's tired and she's hungry. Her kids are bouncing off the walls. They're hungry. Her husband refuses to eat another salad. And as she's standing there, she can hear her doctor telling her that she needs to eat better for her heart, that she needs to feed her family different for her children's hearts. The question that we must ask ourselves is, how do we help her? How do we make this easy for her? This talk is about the future of nutrition, and I don't think just giving people generalized information is going to work anymore. We need to change the default options to make the right choices the easy choices. So this is the question that my co-founder, Micah, and I set out to answer. This is my co-founder, Micah Risk. She is an incredible athlete. She's been on the cover of Runner's World twice. She is a brilliant nutritionist, and she's a mom. She has been working her entire life to try and figure out how we can answer this question. My background is that I was a lawyer, and I thought that I would be able to change the food system through law. I quickly found out that there are not enough laws in the United States to do what I thought we needed to do to really make a difference. And so then I went to public policy because I thought, well, we have to change the laws. That's how we will change our food system. And then I found out that that takes a really long time. So then I found tech. And we can move fast in tech, which I found incredibly exciting. So Lighter's not a food company, we're a software company because we saw the potential for software to move quickly, infiltrate people's lives quickly, and scale quickly. And we've now been used in over 130 countries. We saw 2 really exciting trends in the United States that I don't think have quite hit here yet, but they're coming. The first is that we saw that for the first time in human history, our food supply chain is coming online. Food is the last frontier of our digital revolution that touches our daily lives. That was the first trend that we saw, the rewiring of our food system. The second trend that we saw was this beautiful movement in food as medicine. There is an exponentially growing population of healthcare providers that are realizing that they can prevent and reverse chronic disease by getting their patients to eat a plant-based diet or a more plant-based diet. And so what Micah and I asked ourselves is, how do we connect these 2 trends? How do we bring these 2 trends together? And so what we've done is we've created a world where a mom can go to her doctor, find out that she is at risk for heart disease, but instead of being sent to the pharmacy to pick up a prescription, she can get home and get sent a bag of heart-healthy groceries. This is a piece that went out in Forbes about our work. Tech companies join fight against America's top killers. So what we do when someone is inspired and motivated to change the way we eat as we start to really get to know them and their family, because there's a lot of things to consider. So we ask them questions like, okay, do you have any allergies in your home? What kind of kitchen equipment do you have? How much time do you have to cook? What foods don't you like? These are important questions that we need to ask instead of just handing somebody a PDF that says, here's the things you shouldn't eat, or here's the things you should eat, or just here's a meal plan that works for a bunch of people but maybe isn't customized for you. In many ways, we're transforming the way people take that information about what they should be eating and really making it actionable in their daily lives. I hope that you are all starting to think about your own ideas, whether you're investing, whether you're an entrepreneur, even in your nonprofit. How can we continuously keep that mom in mind and make sure that we make the right choices, the easy choices?